Hello everyone, welcome to my another video. Today we discuss about special MCQ for NORCET. This is part 11. If you like the video, please subscribe to this channel. Question number 101. The nurse do which of the following actions first when admitting a multigravid client at 36 weeks gestation with probable diagnosis of abruptio placenta? Option A. Prepare the client for a vaginal examination. B. Obtain a brief history from the client. C. Insert a large gauge intravenous cannula. D. Prepare the client for an ultrasound. Right answer is option C. Insert a large gauge intravenous cannula. As we know, abruptio placenta is one form of antepartum hemorrhage where the bleeding occurs due to premature separation of a normally situated placenta. In this condition, we have to first insert a large gauge intravenous cannula. Next question. Which of the following position is used for patients with continuous RT feeding? Option A. Supine. B. Fowler's. C. Reverse Trendelenburg. D. Side lying. Right answer is option B. Fowler's. Ryle's tube is usually inserted through the nose of the patient and passes through the throat and goes down to the stomach. Fowler's position is used for patients with continuous Ryle's tube feeding. To prevent aspiration, we must check the tube placement before each feeding. Next question. In the fetal skull, the bregma is found. Option A. At the junction of sagittal, coronal and frontal suture. B. At the junction of lambdoidal and sagittal suture. C. Between the two halves of the frontal bone. D. Between the frontal bones and parietal bones. Right answer is option A. At the junction of sagittal, coronal and frontal sutures. Bregma is also called anterior fontanelle. It is found at the junction of sagittal, coronal and frontal sutures. It is diamond in shape and it is closest by 18 months of age. Next question. Patient with DVT, that is deep vein thrombosis, is advised low molecular heparin. At which site nurse will administer this? Option A. SC. B. IM. C. Oral. D. IV. Right answer is option A. SC, that is subcutaneous. Low molecular weight heparin has excellent bioavailability when given by subcutaneous route and can be administered once or twice daily. Next question. Which part of pancreas produce and secrete insulin? Option A. Glomerulus. B. Bowman's capsule. C. Islets of Langerhans. D. Loop of Henle. Right answer is option C. Islets of Langerhans. Insulin is secreted by beta cells of the pancreatic islets of Langerhans in response to food. All other options are the parts found in kidney. Which of the following are the characteristic features of type 1 diabetes mellitus? Option A. Type 1 diabetes is caused by an absolute deficiency of insulin. B. Type 1 diabetes is associated with the autoimmune destruction of beta cells. C. Patients with type 1 diabetes present with diabetic ketoacidosis. D. All of the above. Right answer is option D, all of the above. Option A, B and C all are the characteristics of type 1 diabetes mellitus. So the right answer is all of the above. Next question. Number of bones in female pelvis are option A 1, B 4, C 3, D 2. Right answer is option B 4. The female pelvis consists of 4 bones, 2 innominate bones or hip bones, 1 sacrum and 1 coccyx. Next question. Which of the following is the ideal pelvis for childbearing? Option A anthropoid, B platypoid, C gynecoid, D android. Right answer is option C gynecoid. Gynecoid pelvis is the ideal pelvis for childbearing. It is the most suitable female pelvis shape. In this pelvis, round pelvic inlet and shallow pelvic cavity with short scale spines is found. Transverse diameter is more than anterior-posterior diameter and it allows normal childbirth with ease and is most suitable for childbirth. Next question. In fetal circulation, deoxygenated blood is present in option A umbilical artery, B umbilical vein, C pulmonary artery, D all of the above. Right answer is option A umbilical artery. Umbilical artery contains deoxygenated blood. All other blood vessels contain oxygenated blood. Next question. Wide gap in the suture is called option A diameter, B circumference, C fontanelles, D inlet. Right answer is option C fontanelles. The wide gap in the suture is called fontanelles. The space between the bones of the skull is called suture and the area where the sutures meet is known as fontanelles. These sutures and fontanelles helps the fetal skull to mold during the process of delivery. So this is the today's video. Thank you so much for watching my video.